In 2012, the Center for Interventional Endoscopy was created to bring advanced endoscopic therapeutic techniques to the state of Florida. Florida Hospital is the flagship of Adventist health system, and it was built on the shores of the lakes behind us over 100 years ago. The mission of Florida Hospital is to extend the healing ministry of Christ, which we feel is unique, and patients feel that as they enter the hospital.
The mission for the Center for Interventional Endoscopy at Florida Hospital mirrors an academic mission. So part of the mission is to perform advanced endoscopy at the highest level. The second part of that academic mission is to perform robust clinical research. And the third part of an academic mission is to teach. We want to be involved in teaching the next generation of therapeutic endoscopists.
The Center for Interventional Endoscopy uses the latest in integration technology that allows for recording and streaming of procedures all over the world. This allows the physicians to demonstrate emerging techniques as well as showcases that require advanced technique.
The research interests for the Center for Interventional Endoscopy is mainly focused on pancreatic and biliary diseases. We work a lot on diagnosing pancreatic cancer by performing endoscopic ultrasound, guided biopsies, and also we do a lot of cutting-edge research on management of walled-off pancreatic necrosis. We also do a lot of research on common bile duct stone management and endoscopic resection procedures.
Cytopathology benefits the patient because it allows for you to be able to do minimally invasive procedures. So there is a lower cost than surgical procedures. Patient has lower morbidity, so less likely to be sick. And it allows for a high diagnostic accuracy.
Laryngoscopy is a digital optical probe which actually can go through a ERCP scope and can be used to visualize the bile ducts and the pancreatic ducts.
The center also serves as a regional, national, and international destination for patients with complex disorders.
We want to be a center where patients can come in and get high-quality medical care for both their inflammatory bowel disease and their complex medical problems along with that.
Volumetric laser endomicroscopy is advanced laser imaging technology which is used for evaluation of Barrett's esophagus, especially the deeper tissue in Barrett's esophagus. By endoscopic mucosal resection, you can prevent major surgery in patients as you are resecting these benign and pre-malignant polyps and lesions endoscopically. It is very efficient, safe, effective, with low risk of complications in experienced hands.
Our hope is, with the research conducted in CIE in the next 10 years or so, will change the way we diagnose cancer in patients, and hopefully we'll come up with better markers for diagnosis of cancers in a minimally invasive way.
We strongly believe that the clinical research that we practice at Florida Hospital is going to be very cost effective and also minimally invasive. This obviously will result in huge benefits to the patients and also the financial burden of our healthcare system.
From our nurses, to our equipment, to our room setup, to our physicians, to our technicians, all of us are working together to optimize the outcomes from therapeutic endoscopy. This is the way patients benefit from coming to CIE.